Assessment. Assess the woman's status. Assess the client's ability to follow instructions. Planning. Gather all the items you will need for the procedure. For easy accessibility. Implementation. Identify the client, introduce yourself, and explain the procedure. Explain the procedure to the client. Tell her that it will be uncomfortable but she has to relax. Take slow, deep breathing and stay still. To relieve anxiety and apprehension, encourage the client to urinate. If she is unable to do so, catheterize. A full bladder can weaken contractions and delay the separation of placenta. Ask her to lie down on the bed on her back with legs apart and drape the patient. For easy visualization and to provide privacy. Start intravenous infusion and incorporate 10 units of oxytocin into a liter of intravenous fluid. Restore blood loss and treat shock. To keep the uterus well contracted and stop the bleeding. Wash your hand. Put antiseptic solution over the woman's perineum and put on sterile gloves. This protects you by preventing any accidental contact of a substance that could carry a microorganism through break in your skin. Inflate the intrafoley catheter balloon with sterile, room temperature 0.9% sodium chloride until it can be seen in the cervix, typically 250 to 300 ml, 500 ml maximum. Record the volume used. To check if there is leakage on the inflated balloon. Tape the patient's catheter to the patient's thighs. To apply gentle traction to the catheter. Connect the drainage port to a fluid collecting bag or urine bag. To monitor the amount of blood loss. Remove gloves and wash hands. For infection control. Monitor for the vital signs, uterine output, fundal height, vaginal bleeding, and amount of blood loss. To monitor if the client is experiencing hypovolemic shock. Documentation. Document the date, time, and the procedure that was done to the patient. To provide accurate data in the care of the client.